So can you get rid of a bad BBL or Brazilian butt lift? Hello, my name is Dr. Sive Gallagher, and in this video we're going to talk about a growing procedure I'm seeing in my practice, and that is the request for a Brazilian butt lift reduction or reversal. So first of all, basically, what is a BBL? Most people are very familiar with it. It's a super popular procedure here in Miami. It's where fat is liposuctioned from elsewhere in the body, usually the trunk, the belly, and injected into the buttocks. I don't do it in my practice. I haven't done it for about 5 years now, just because I'm a little bit scared of it. Well, more than a little bit scared of it. It is a pretty notorious procedure because it is somewhat dangerous in that fat can get into the blood vessels and cause death. So the rate of that is 1 in 3,000, and that's why I stopped doing it. There are certainly surgeons who do it very safely and very well, usually under ultrasound guidance, but I personally wouldn't have one, so I've stopped providing them several years back. Having said that, now we're seeing patients, especially from here in the Miami area, who are not happy with the results, and we also see it in celebrities as well, that they have these shrinking buttocks. So how are we able to achieve this? So first of all, plain old weight loss, because when we're injecting your own fat in, if you lose weight, those fat cells should shrink. So that is a possibility in some patients, but usually the most common thing we'll do when a patient comes to us is look at the buttocks, see what the patient doesn't like, what is it about the shape. The most common things we hear are lumps and bumps. These are super common because fibrosis or scarring of that fat on the inside is incredibly common after this procedure. So it's usual for it to be lumpy, bumpy. If the fat was put a little bit too superficial or close to the surface, it can have a very lumpy result, and that is a tough thing to correct. Other times I hear it's just too big, and usually the patients typically will focus on the hip areas. They don't like how wide those hips are and how big the buttocks are in general. Sometimes patients don't like the shelf-like deformity where there's no fat and then it transitions out into an unnatural shelf in the upper part of the buttocks. Saggy skin is a big problem. That's a tough one to fix. But these are the most common reasons patients will come to me unhappy with the results and wanting to do a reduction. So this is a tough procedure because we are somewhat relying on your skin to shrink down, and what we don't want to do is just go in, remove everything, because then the buttocks would collapse. So there's a few cardinal rules we have to follow when we're doing these procedures. First things first, we have what's called a no-fly zone. So basically the lower part of the buttocks, there is a hammock-like structure. It's connective tissue in there, and we do not want to mess with it. Potentially, if we go in and aggressively suction the lower buttocks and the upper backs of the thighs, we'll collapse all this, and then that means that the gluteal fold sometimes can even be effaced, which looks very unusual. So we lose the fold, or everything just collapses. So we have to be very careful to keep that support system there. So first things first, I'll usually mark the area where we're just not going to go, that no-fly zone, and then really discuss with the patient what are the areas of concern. Luckily, the most common place I usually find folks are not happy with are the hips and the extra tissue put out at the sides. I find a lot of patients will find this not very athletic and don't really like this shape. So that thankfully is usually a pretty forgiving area we can go after and bring that in. Upper buttocks as well, especially if we're talking about that shelf deformity, we can do some liposuction in there at the same time. Always it is my goal when we're doing these procedures to try and smooth out any contour deformities, but that is a tough one definitely to fix, because just like scarring on the outside of the body and the skin is hard to fix, scarring on the inside, it doesn't tend to respond too well to surgery. So we never guarantee that we will improve the lumpiness, but we certainly always try. And so we do all this to try and reduce down the size, but respect that anatomy, respect that sling thinning of connective tissue in the lower parts of the buttocks. So we are somewhat limited to how much we can reduce things. I usually advise most patients who come to me for a BBL reduction to start with liposuction, see where we get. We put patients in compression afterwards to support everything after we've removed the fat, and we give it several months before the patient will be able to see their final result. Typically, because things can swell a lot, because of that previous fibrosis, it can be a little bit bloody, so there can be extra bruising in there. You won't see your final results for about 6 months. At 6 months, it may still be a little bit lumpy. We can expect some improvement in that, but usually we'll want to give it at least 6 months after the surgery, see how everything has settled down. In most patients who have good quality skin, we get lucky and things still look good and the buttocks don't collapse. In a minority of patients, and especially patients who've been really big when we do an aggressive reduction and a lot of liposuction, or even have had some weight loss themselves, we may have a collapse of the buttock tissue there. In that case, if the patient wants to fix it, we have to discuss what's going to be best for them, because there is no way to fix it without putting a scar there. The most common place we end up putting the scar is across the lower back. Thankfully, this incision tends to heal quite well, and we lift everything up in that way, get an improvement on the fold underneath, and get a more natural shape to the buttocks in that situation. This is the typical approach for this. Weight loss at home, working out, that can help for sure, but it is something we're definitely seeing a lot more. If this is a procedure you're interested in, we're accepting consults right now here in Miami. Most patients coming for this procedure travel in from outside of town, so we're quite used to that. Typically, the surgery takes 1 to 2 hours. We do it under general anesthetic, so you do go to sleep for it. Most of our patients are in town about a 5-day minimum, depending on what exactly we've done. And like I said, you don't see your final results for about 6 weeks. Recovery tends to be not as bad as the original BBL, because we're not as strict about thinning restrictions and that sort of thing, but we do put you in a faja, we put you in compression, which is very important for at least 6 weeks after the surgery. So like I said, we're here in Miami, we're accepting consults right now for this, and you can get me by reaching out to our website, which I'll link in the comments.